In this final lecture, we're going to touch on some of the basic principles involved with development of muscle strength and muscular endurance, which, of course, contrasts with cardiorespiratory endurance. But we define muscle strength just simply as the maximum ability of a muscle to develop force or tension. Muscular power is related to muscular strength. However, muscular power will also incorporate a time element to force production. And so power is just simply the application of force at a particular speed of movement. At a given force, the faster the speed, the greater the power that's generated. Stated alternatively, if a movement is conducted at a particular velocity and that velocity is maintained by increasing the force, more power is generated. And so in terms of developing training goals as it relates to strength and muscular endurance exercise, the overall goal here is to develop strength and power. And this goes to supporting and enhancing a person's ability to develop force over a short period of time, and that's typical of strength application. Recall that when we talk about cardiorespiratory or aerobic endurance, that certainly requires force production, but that force is going to be much, much lower in magnitude, but carried out for a longer period of time. The goal here is to improve muscular endurance, which is something that's typical involving repetitive muscular work. By improving flexibility, this is indirectly related to the development of muscle strength and endurance, but it is an important component that we'll touch on a little bit later in this lecture, and that goes to enhancing joint range of motion. How muscle strength and endurance can improve body composition is through muscle metabolism. And so with the inclusion of a regular period of resistance exercise, whether it's a healthy person or a person afflicted with some sort of disease or condition, enhancing skeletal muscle composition and quantity would elevate overall body metabolism, which would in turn use stored fatty acids as a fuel source. So indirectly, strength training can improve body composition by enhancing the tissue that would typically burn fat as a fuel source. And the training goal here with strength and endurance is to reduce overall the risk of falls, activities of daily living or leisure activity effort. So the same task can be carried out day to day with less perceived effort, and to reduce the onset of muscle fatigue. With respect to the skeletal system, engaging in strength and endurance and muscular endurance exercise will overload the skeletal system. And one of the greatest predictors of developing bone strength is weight-bearing type of exercise, and that is achieved through one way that which that's achieved is through resistance exercises to increase the force applied to bones, and that will accelerate bone mineral or enhance bone mineral density. Strength and endurance and muscular endurance training can be an adjunct or ancillary to cardiorespiratory exercise and training, in that blood glucose regulation, just as one measure of better overall body control of metabolism. There's a concept referred to as the FIT principle, and where the FIT principle is a convenient acronym to thinking about some of the key elements that should be considered with respect to muscle strength and muscular endurance training, where the F stands for the frequency of exercise. And so it's recommended that from a general fitness perspective or in a new patient that a component of their regular exercise should include 1 to 3 days of exercise focused on the development of muscular strength or muscular endurance. The I refers to the intensity of the exercise. And so one such guideline, and again, this is just an example of a guideline, is to use 70 to 80% of what's called the 1RM. 1RM stands for the repetition maximum. So the maximum amount of weight a person can lift for just one repetition as an indicator of their maximum strength. Now, 70 to 80% is a fairly high load. So with a person that might be new at performing strength and muscular endurance exercise, a selection of a lower load, a lower relative load down to, or maybe around 40 to 50% would be indicated. So that is something that's fairly objective. In terms of a subjective way to gauge exercise intensity is to have the person subjectively select a load in which they could perform anywhere between 8 to 12 repetitions. And so once again here, that's the repetition maximum to near maximal exertion. Once again here, these are just examples of guidelines that is probably more or definitely more applicable to somebody who might be a more experienced exerciser with these resistance modalities. The first T stands for time or duration. And so this is going to be related to the number of sets and the number of repetitions per set. So another common guideline that is often used is that a person would perform a particular exercise repeatedly, somewhere between 8 to 12 repetitions. They would then rest for about 2 minutes, which is roughly around an optimal period to allow that isolated muscle recovery, and to perform anywhere from 1 to 3 sets. The final T in the FIT principle stands for the type or the mode of the resistance exercise. And so ideally, this exercise should consist of both concentric and eccentric muscle actions. And as a review, concentric contractions refer to those in which muscle force is applied when the muscle is shortening in length. An eccentric muscle action is one in which a muscle is applying force while it is lengthening. And so the eccentric muscle contractions are the ones that are typically used to control a particular movement. And we'll take a look at these two pictures here shortly. It's also recommended that a general program of resistance exercise should include some combination of both single joint and multi-joint exercises. So if we take a look at the top right-hand corner of the slide, here we see a person using a standard exercise machine that you would find in any fitness facility, and they're doing an isolated knee extension. So as this person performs the dynamic task of lifting the weight by extending their knees, they're performing a concentric contraction as the quadriceps get shorter. As the person controls the weight back down to the start position, their quadriceps are still contracting, but they're contracting as they're lengthening and controlling the weight back down to the start position. So the only joint involved in this exercise is the knee joint. And the advantage of these single joint exercises is that it allows an isolated focus on one particular muscle group. But as we move into multi-joint exercises, as we can see with this person performing a squat maneuver, as this person was in a standing position, moved into the squat position, their muscles would be acting in an eccentric manner. So the quadriceps would be getting longer into this position. They would be lengthening, performing an eccentric contraction. As the exerciser moves back into the standing position, one example muscle, once again with the quadriceps, that muscle would be producing force to push the exerciser upright and will be doing so while the muscle is shortening. Now, this particular exercise task can only be achieved with simultaneous hip, knee, and ankle motion, making it multi-joint. So the advantage of the single joint, once again, is to isolate one particular muscle group for strength development, while the multi-joint exercise would simultaneously activate numerous muscle groups and start to replicate more of a functional type of task that a person may perform day to day. So people don't typically perform squatting, but people that would ambulate or walk during the day would be engaged in that weight-bearing exercise, which is what this would be doing. Moving on to flexibility training. Flexibility is just referred to as the ability to move a joint through its full range of motion. And flexibility is important because it is associated with postural stability and balance, not just standing balance, but even seated balance. That flexibility does become an important, as a person, even if they're seated, wishes to reach out to grab some object, their joints have to go through a particular range of motion in order to be functional in that regard. There are the two most popular assessment tools to measure a person's range of motion includes what we see here as a clinical goniometer that a therapist or an exercise physiologist would align and ask as the person moves through, in this case, elbow flexion and elbow extension, the goniometer would provide a numerical value of how much range of motion a person has. Another popular method is what's called sit and reach for lower extremity flexibility. And so on the top of this box is a scale in inches, and the person is just simply asked, as long as they keep their knees locked and their feet pressed up against the box, to lean forward as an indicator of their lower posterior, what's often called the posterior chain flexibility or range of motion. There are two general types of stretching exercises. The first is referred to as a static exercise. And in this case, a person would move a muscle into a lengthened position, such as this person right here. So this person leaning forward would be isolating the muscles on the what's often referred to as the posterior chain in the leg or the hamstrings, and to some extent the gastrocnemius muscles, and then hold that position without moving for 8 to 10 seconds. The second type is referred to as ballistic stretching, and this involves quick cycles of moving into a stretch position, coming back into where the trunk is upright, stretch, and this would be repeated a number of times. For a person that is beginning a flexibility program, it is strongly recommended that they focus on static stretching first before moving into a more advanced ballistic type of stretching. Another effective, or the third effective mode that's not used as often as static or ballistic, is what's called PNF, or proprioceptive neuromuscular facilitation. And in this particular type of approach, it involves a combination of static contraction or static stretches along with muscle contractions. And so this process begins with a passive static stretch. And so what we see here is this person in the lower picture would be leaning forward, stretching the hamstring muscle group, and then after holding this position for about approximately 8 seconds, staying in this position, would consciously contract the hamstring muscles and hold that contraction isometrically for about 8 seconds. The person would then relax and they would be able to lean forward and engage in more of that passive static stretch. And the mechanism through which this works is neuromuscular, or just simply neural in nature, as the muscle contraction would activate sensory receptors and sensory neurons embedded in the contracted muscle that would feed back to the spinal cord and induce further hamstring muscle relaxation. So overall, when we think about flexibility training, it's often recommended that a person performs this 2 to 3 days per week. However, a question that often comes up is, can flexibility be performed daily? But would that be too much? Keeping in mind that flexibility training, although it's recommended 2 to 3 days, can actually be done every day. Because this type of training, this type of exercise does not require active muscle contractions. And so the development of muscle fatigue or any other extreme alterations in muscle metabolism would not be present with flexibility training. If one uses the static approach or uses PNF stretching, it's often recommended that it be held. Some recommendations include 10 to 30 seconds. 30 seconds is kind of long, but the most common recommendation is 10 seconds. It's recommended stretches should be performed to mild discomfort. Discomfort's a strong word. I would often say that the person generates a perception, conscious awareness that the muscle is being stretched. So there should be no pain involved whatsoever with holding that, but the person should know that the muscle is on stretch. Overstretching a muscle doesn't necessarily improve the benefits of flexibility training. And it's often, to continue with these guidelines, each stretch should be performed anywhere from 3 to 5 repetitions as a standard guideline. So this ends our final lecture here on Unit 3.